Hello, my friends. How are you doing today? So, what if I told you skipping meals twice a week is proven to be more beneficial than some of the leading diabetic drugs that you are consuming? I know it sounds unreal, and when I came across this randomized control trial of this fasting and comparison to the drugs, it was really interesting. So without further ado, let's break it down and let me share and learn together with you what I can take away from this and how we can apply it to our respective demographics. Let's get right into it. So, could a specific intermittent fasting protocol combined with meal replacements, so they were provided with some meal replacements, be as effective or superior to these two leading standard first-line medications, which are Metformin and empagliflozin? From where I come from, these are pretty common. I am pretty certain where you are, this is also some of the most leading medication versus this 5 days of eating and 2 days of intermittent fasting with the meal replacement. So, the study was fairly rigorous and it's a real-world test whereby a gold standard for this sort of intervention is a randomized control trial, and it is a randomized control trial conducted in 9 hospitals in China, and the study name is the Early Trial Exploration of Treatment of Newly Diagnosed Overweight or Obese Type 2 Diabetes Mellitus, and 405 adults, so they had to be newly diagnosed with type 2 diabetes within a year, fulfill the BMI of about 29.5, no recent use of other anti-diabetic agents. What was written in the text was about 3 months, and an average HbA1c of about 7.9, or anyone who fulfills 7 to 9%. So the fasting group, they followed a structured 5-2 protocol. Now this was a 16-week intervention based on 7-day cycles. So out of 7 days, they will eat regular meals for 5 days and fast for 2 days. Now these 2 days, they cannot be on consecutive days, so they have to be spaced out, and all of their 3 regular meals were replaced with a provided low energy meal replacement product. And what do they mean by that is, now this meal energy replacement product is supplied by some company which primarily had omega fatty acids and some low acid chains in the meal, but they didn't specify what more it contained now, so that's a limitation. And the total daily energy intake was restricted to 500 kilocalories for women and 600 kilocalories for men. And on the other 5 days, they ate their breakfast and lunch according to whatever they want, as long as they documented it. But their dinner, they were given a replacement product. So 2 products were used in this. Now, the medication groups, these groups were randomized into further 2 separate groups, and in this 16 weeks, one group was subjected to metformin of 0.5 gram twice daily and eventually escalated to a maximum of 2 grams per day. And the other group had taken empagliflozin, where they used a 10 mg dose. And all of these 3 groups, what's common among them was that they received the standard dietary advices, diabetic guidance, exercise guidance. So now the question that we want to answer: hey, does fasting help me? Please tell me, doctor. Please tell me myself. I want to know. So primary outcome in this study, or the main thing they're looking at, was the HbA1c. HbA1c is your glycated hemoglobin, or that's the medical term, or every 3 months when our red blood cell, we can say, destroys itself and form new ones, the number of cells that have sugar influence on these cells are measured every 3 months, as they break down every 3 months. So we want to measure it before it breaks down. I hope I explained that clearly. If not, that's another idea for another video. So the HbA1c reduction, if you can look at it, in the fasting group, they had reduced the HbA1c by 1.9%. It's a lot for 4 months, a lot. Metformin group 1.6 and the empagliflozin group 1.5. So it's pretty interesting, and it surpassed the group which had consumed the medication. They also noticed that these groups who had done the intermittent fasting actually had higher rates of diabetic remission. and remission would mean a HbA1c of less than 6.5. 80% in the group that were fasting, 60% in the metformin patients, and 55% in the empagliflozin patient. And they even mentioned that even after an additional 8-week follow-up period, 76% of available participants from the fasting group actually maintained their HbA1c below a 6.5%. So that is something where it had a longer effect, even though they may or may not have been continue to fast. Also, these good benefits also spilled over to some cardiometabolic markers. What are cardiometabolic markers? Markers that can improve our cardiac health. So the waist hip circumference, greater reduction, blood pressure, significant reduction in both systolic and diastolic, the upper level and the lower level, and also improved triglyceride levels, that's the cholesterol in the blood, and improving the good cholesterol. Now this one I think is a bit biased, a personal opinion, because the meal replacement had contained some omega fats and things like that. So adverse effects, any intervention that we do, we are so interested in the doctor, what will this do to my body negatively, right? So fasting groups and plus that meal replacement that they had consumed, they had 9 events, and serious adverse events none. Hypoglycemia or low sugar outcomes where one tends to feel dizzy, sweating, tremors, 8 patients. Perhaps someone who is diabetic is actually more prone to hypoglycemia if they fast, and constipation, as opposed to the drug categories where it goes without a saying that all medications do come with a certain amount of adverse effects. Only 2 had serious adverse effects, and the rest were pretty similar, with hypoglycemia, and metformin, as we know, has quite a notorious GI side effect. And so the intensive dietary intervention had a far more favorable safety profile than the other 2 standard medications. So all studies have what we say limitations, or things that a good researcher, not me, I'm still new to this, need to look out for. What makes this study not that reliable? So from what I've identified, firstly, it, as the study mentioned, and the target population is highly niche down to the Chinese population. So we cannot generalize these findings to my country, to the Caucasians. It's not medically sound to say that. And number 2 is that the intervention was only for 16 weeks. So you may study the short-term outcomes, but what about the long-term effects of someone doing this on their body? And the limited scope, whereby only a couple of parameters were measured. Of course, this study was highly focused on diabetic and HbA1c outcomes, and they fulfilled it. So like I said, had it been done longer, we may know other outcomes. And the adherence challenge. Now, one thing that makes a very good randomized control trial is when the investigator, is blinded, the patient is blinded, and the person interpreting the result is blinded. However, it was a bit difficult to do that in some parts of their methods, but they knew what they were getting, so to speak. So maybe that will make them a lot more compliant or adherent, as opposed to me not knowing it and just going with the flow. So and also the adherence challenge in another context will be, is this 2-day in a week fasting sustainable for someone on the long term, as opposed to someone taking medications? Okay, so what does this mean for you and I, who may not exactly be Chinese? This study, well, technically we cannot generalize it to us, but can we implement this onto us? Yes, because I think ethically there is no major side effect. We are fasting for 2 days and having 1 meal a day, which however you want to replace that meal. It sounds like they have focused on good fats, meal replacement with good fats and protein maybe. So the choice is yours. Please consult your dietitian, and please inform your treating practitioner should you choose to attempt this, because this is a short-term study in a different population, so we need to know if something is going on with the body, right? And that's it from me today. So I hope this helped you. It definitely helped me to understand something. And see you in the next one. If you have a suggestion for a topic, or if you are actually trying this out with metformin, let me know how it goes in the comment. Yep, have a good day then.